When the stress response stays on, it triggers a cascade which can lead to insulin resistance that makes emotional regulation and cognitive functioning extremely difficult. We've talked in the past about how when we're in fight or flight, when our stress response is activated, our body is shunting blood glucose to that ability to fight or flee. So it reduces the amount of blood glucose going to the prefrontal cortex, all of our organizing, thinking, rationalizing. That kind of goes into the crapper while we prioritize getting safe. So it's harder for people to think clearly when they are stuck in fight or flight. Unfortunately, when people start to develop insulin resistance, they actually create a situation where their body is constantly feeling like it's in a vulnerable state because it's not getting enough glucose into the muscles and into the cells. Today, we're going to look at the impact of cumulative stress. We'll explore the bidirectional relationship of insulin resistance and mood and cognitive issues. We'll identify symptoms of metabolic issues and mental health, explain blood sugar regulation mechanisms, differentiate between types of diabetes, and then finally explore interventions. So some of the main points, because today, obviously, we're talking about medical stuff or physiological stuff, which is not necessarily in everybody's wheelhouse. But what I want you to think about as we're going through today's presentation is that cumulative stress across all pieces of life, that's physical, interpersonal, emotional, cognitive, environmental, and spiritual, can contribute to the development or worsening of insulin resistance and diabetes. When people are experiencing cumulative stress, that stress response stays on. The body keeps dumping blood sugar. The liver and pancreas keep trying to help manage what's going on, and it feels like it's not working well. Insulin resistance and unstable blood sugar further trigger the stress response. Insulin resistance and unstable blood sugar cause many symptoms of mental health issues, including fatigue, irritability, emotional dysregulation, anhedonia, low motivation, increased aches and pains, sleep changes, brain fog, cognitive slowing, racing heart, shakiness, and cravings for both high sugar, high fat foods, and for some people, for substances. And we're going to talk about how that happens in a couple of slides. Helping people understand the connection between stress, chronic stress, their blood sugar regulation, and their symptoms often demystifies some of the neurophysiology and empowers them to make positive behavioral changes. I've said so many times that any positive change in any of the pieces of life that helps reduce stress is likely going to have positive effects on all the other pieces of life. So if somebody feels stuck with where they're at with handling the cognitive stuff right now, okie dokie, let's pivot and let's look at some other interventions that might be useful. Tools that help reduce stress in any of the pieces of life will help stabilize blood sugar and improve many symptoms. So what we're really doing, the crux of it, is we're helping people rebalance their autonomic nervous system. So their parasympathetic, their rest, digest, and repair can turn off the stress response, the fight or flight, their sympathetic nervous system. That's what we're doing. There's no magic to it. Why